Hi, I'm Sylvia Azania, and we are going to talk about the anti-Müllerian hormone. We will talk in detail about what anti-Müllerian hormone is and why it plays an important role in women, when to perform the analysis, the normal values, how anti-Müllerian hormone varies with a woman's age, and its usefulness and relevance in assisted reproduction. We will also discuss the cost of the anti-Müllerian hormone analysis, and we will answer several of the most frequently asked questions that users might have related to this subject. The anti-Müllerian hormone is a specific type of hormone that is present in both men and women, but with different functions and locations. The primary function of this hormone takes place during pregnancy, where it plays a key role in the sexual differentiation of the fetus. In male fetuses, anti-Müllerian hormone is secreted by the testes starting approximately at 8 or 9 weeks of development. The goal is to prevent the development of the Müllerian ducts, since these are the structures that give rise to the uterus and the fallopian tubes in females. In female fetuses, the absence of anti-Müllerian hormone enables the proper development of the female reproductive organs. Yet, the anti-Müllerian hormone will begin to show up a few weeks later when ovarian follicles are formed. After birth, the levels of anti-Müllerian hormone remain high in males until they reach adolescence, but during adulthood, those levels stay consistently low. Conversely, in females, the anti-Müllerian hormone starts to become important from the onset of puberty. It is produced by the ovarian follicles, the structures where the eggs develop. The anti-Müllerian hormone is generated by the preantral and antral follicles found in the ovaries during the entire reproductive lifespan of a woman. In short, from puberty until the arrival of menopause. Specifically, it is the granulosa cells surrounding the egg that are responsible for synthesizing it. The significance of this hormone is that it serves as a biological marker to estimate a woman's ovarian reserve. In other words, the measurement of anti-Müllerian hormone levels in the blood gives us a clearer idea, allowing us to estimate the number of eggs that still remain in a woman's ovaries, which is her ovarian reserve. It is crucial to note that additional tests are performed in the assessment of female fertility. A hormonal assessment that measures levels of other hormones such as FSH and LH, along with an antral follicle count through transvaginal ultrasound. The anti-Müllerian hormone is produced by the preantral and antral follicles of the ovary. The significance of this is that anti-Müllerian hormone values do not vary with the menstrual cycle. Thus, the blood analysis used to evaluate anti-Müllerian hormone levels can be performed any day of the cycle without influencing the outcomes. It is also unnecessary to fast for the determination of anti-Müllerian hormone concentration. However, it should be noted that, especially before assisted reproduction treatment, other hormones are also taken into consideration and assessed, such as FSH and estradiol, both of which must be analyzed under baseline conditions. For all these reasons, it is more practical and convenient to measure the anti-Müllerian hormone together with these other hormones in a single blood test at baseline conditions. These are the first days of the menstrual cycle, between 3 and 5 days after the onset of menstruation. And before continuing with the content of this video, I'm going to ask you, if you like it, to please give it a like and subscribe to the channel if you haven't already done so, as this helps us to continue and ensures that all the information we publish reaches more people. The levels of anti-Müllerian hormone allow us to estimate a woman's ovarian reserve status. Nonetheless, multiple methods exist for detecting anti-Müllerian hormone, making it challenging to compare results from different techniques. It is most convenient for the interpretation of each patient's results to be carefully done, taking into account the cutoff values for each test. Nevertheless, I'm going to mention the reference ranges for the technique that is most commonly used in laboratories, although there could be some slight differences. Very high anti-Müllerian hormone, levels greater than 6 nanograms per milliliter. There could be a risk of ovarian hyperstimulation syndrome when hormonal medication is administered during IVF. High anti-Müllerian hormone between 3 and 6 nanograms per milliliter. Ovarian reserve is good. Normal anti-Müllerian between 1 and 2.9 nanograms per milliliter. Indicate good ovarian reserve. Normal low anti-Müllerian between 0.7 and 0.9 nanograms per milliliter. Ovarian reserve has started to decrease, although it is still within normal limits. Low anti-Müllerian levels between 0.3 and 0.6 nanograms per milliliter. They suggest low ovarian reserve. Very low anti-Müllerian hormone levels, specifically levels lower than 0.3 nanograms per milliliter. The ovarian reserve has nearly run out, and the woman finds herself close to menopause. If one wishes to have a baby, it is likely that it will be necessary to resort to egg donation. Anti-Müllerian values can also be expressed in other measurement units, for example in picomoles per liter. As a woman ages, her ovarian reserve, that is the number of eggs remaining in her ovaries, gradually decreases. Consequently, the levels of anti-Müllerian hormone also tend to decrease over time as a result. Ovarian reserve starts to noticeably decline after age 35, with a much sharper drop beginning after 40. However, there are some women who might have a reduced ovarian reserve even at an earlier age. This is the situation referred to as premature menopause. Thus, understanding ovarian reserve status can assist women in planning their future motherhood more effectively. They could make decisions such as the following. Preserve your fertility if you want to be a mother in the future. In other words, freezing eggs for a future use. Another option is advancing motherhood to an earlier time. One of the main advantages of determining the levels of anti-Müllerian hormone in assisted reproduction is that it allows for a thorough assessment of the patient's ovarian reserve, thereby enabling the specialist to accurately prescribe the most appropriate treatment and hormone medication regimen. A correlation exists between anti-Müllerian hormone levels and the ovarian response to stimulation. Therefore, patients with high anti-Müllerian hormone levels could face a risk of hyperstimulation. Patients with lower anti-Müllerian hormone levels would have a higher chance of a poor response. Anti-Müllerian hormone might be beneficial for forecasting the success of assisted reproduction therapies. In this way, a more precise recommendation regarding the suitable technique for each patient can be established. The determination of anti-Müllerian hormone in blood is a test that can be performed as part of a female fertility study or separately. Prices may vary widely depending on the clinic and the laboratory conducting the test. On average, the cost of female fertility assessments ranges from 120 to 450 euros. They include a vaginal ultrasound and hormonal analysis. Expensive options also include AMH analysis. Should only the anti-Müllerian hormone test be conducted, the cost ranges from about 50 to 80 euros. And now, we are going to answer the most frequently asked questions that users may have in relation to this topic. If I have low anti-Müllerian hormone levels, can I get pregnant naturally? The anti-Müllerian hormone serves as an indicator of a woman's ovarian reserve. Therefore, a low anti-Müllerian hormone level in a woman indicates that her ovarian reserve is also diminished. Nonetheless, this does not imply that it is impossible to conceive naturally. It is necessary to consider the precise value that has been obtained, along with other significant factors that are crucial for achieving gestation. Factors such as the semen quality, fallopian tube permeability, and endometrial receptivity are important. If natural pregnancy isn't possible, we could consider assisted reproduction techniques. I have high anti-Müllerian hormone levels, but I can't get pregnant. What's happening? The anti-Müllerian hormone is a good and reliable marker of ovarian reserve. If blood levels of this hormone are high, it indicates that the ovarian reserve is good. Nonetheless, this does not necessarily imply that there are no other conditions that could be affecting female fertility. It is also important to mention that if anti-Müllerian hormone levels are elevated, it may indicate polycystic ovary syndrome. In any case, if you have been trying to conceive for 12 months without success, or 6 months if the woman is over 35 years old, it would be advisable to visit an assisted reproduction clinic and have a fertility assessment. Can anti-Müllerian hormone be increased? Unfortunately, there is no way to improve a low anti-Müllerian hormone levels at this time. Anti-Müllerian hormone is a good marker of ovarian reserve in women. The levels of this hormone are used to estimate the number of eggs remaining in a woman's ovaries at a given time. As time advances and the age of a woman increases, her ovarian reserve declines, and consequently, the levels of anti-Müllerian hormone drop. However, leading a healthy lifestyle, quitting smoking, eating a healthy diet, taking certain vitamins, reducing stress, maintaining a healthy weight are some tips that will always be beneficial for fertility. We would love to hear about your experience, so I encourage you to please leave us a comment below.